The UK is facing an epidemic of skin cancer. In summer 2007, Cancer Research UK released statistics showing that melanoma, the most serious form of skin cancer, is the fastest rising cancer in the UK. Melanoma now claims more lives in the UK than in Australia. There's no cure for melanoma, only early detection saves lives. Britons now face a 1 in 10 chance of developing a skin cancer during their lives, but very few GPs in the UK are trained to diagnose skin cancer. So just how can the public find out if they're at risk? Sue Watson from Kent noticed a new mole appear on her knee just over a year ago. It's small, but her husband Graham asked her to have it checked. They're called the Mole Clinic in London. Established in 2003, the Mole Clinic operates a network of 20 independent diagnostic centres for skin cancer.
I can see you're concerned about a mole on your leg.
Yes.
Can you tell me a little bit about that and why you're concerned?
I noticed it about 15 months ago,
Right.
just sitting in the garden, didn't remember seeing it before. Said to my husband he didn't remember it, and we sort of tried to measure it by drawing round it on that time.
Okay.
And then about a year later we had another look and it has grown slightly.
Today, the Mole Clinic team includes the only nurse specialists in the world to have passed the International Diploma in Demoscopic, one of whom is Kate Sauerbuts. They're trained to use digital imaging cameras to look beneath the surface of a mole and see cancer much earlier than before.
Sue, we're just going to turn the lights off so we can have a look inside the mole, okay? And as you can see on the screen here, you've got some blue-white features just here and some dark globules, okay, which are darker. And it's actually these features that actually allow me to know that actually this mole contains melanocytes and therefore can get melanoma, okay? Moving on from there, I'm then looking further into dermoscopic features. And actually what I can see is a number of dermoscopic features which are actually atypical, okay?
Having looked beneath the surface of Sue's moles, the Mole Clinic nurse is confident that she has seen clear evidence which would justify referring Sue to secondary care.
Having mentioned all those features, I would definitely recommend that this mole is to be excised by a dermatologist or other specialist. And I would say that it is highly suspicious for melanoma.
I had a top-to-toe inspection of all my moles, front, back, everywhere, and they found 2 actually that they then took photographs of. One on my back was fine, thankfully, but there's just one on my knee that is suspect. Other people we've spoken to can't believe that the size of this could cause a problem, so it has made other people think, well, hey, hang on, we better be careful.
How often do you go out in the sun?
Well, it's only holidays. We go abroad, week, 2 weeks, or weekends, you're in the garden, doing gardening. You know, you've just got a little top on or shorts or whatever, and you're just strolling about, you don't realise.
But it's clear that Sue and Graham's decision to come to the Mole Clinic today has paid off. This afternoon, within hours of her consultation, she'll have the mole on her knee removed.
Sue, if you'd like to come with me?
Yeah, sure.
Hello, I'm David Rosin. Do come sit down.
David Rosin is a consultant surgeon in Harley Street and a melanoma specialist. A past president of the Melanoma Study Group, he removes hundreds of suspect moles every year. He'll be carrying out Sue's excision.
And you were seen at the Mole Clinic this morning, is that right?
I was.
And they were worried about one of your moles. What made you go to the Mole Clinic?
My husband and I thought it had got slightly bigger.
Right.
When they looked at this, they thought it was a bit suspect.
Right, and they took some pictures.
They did, and advised that it was removed.
And it's on your left knee, I can see it quite
Yeah.
clearly, but slightly raised. And I would agree entirely with the Mole Clinic that that ought to be removed. Before you go down to the operating room, just one last thing. I'm going to put a mark there with an arrow so that we all know which one we're taking off. Okay?
Okay, yep,
In about 5-10 minutes, we'll see you in the operating room.
okay.
One of the Mole Clinic's strengths is its close links with dermatologists and surgeons. The ability to refer a patient with a suspect mole for surgery quickly means waiting time is kept to a minimum. If a mole is melanoma, the sooner it's removed, the better the chances of survival.
I think the great advantage of the mole clinic is that up to now, we just had to inspect people and go by our own experience. Now the mole clinic, we do have a scientific way of seeing whether moles are active. And the earlier we can get them, the better. I mean, the sad thing is that it's not like other cancers. You wear it on your skin, you wear it on the outside.
Melanoma is now the second most common cancer in people aged between 20 and 39. And it's younger people who perhaps had a sunburn in childhood or sunbathe on a binge basis or use sunbeds that David is now seeing more often.
Well, I'm afraid that it is younger people, and that's of course the more dangerous type of skin cancer is in the younger person, the malignant melanoma. And it's not the person who's been exposed to sun for a long, long time. The people, white people in South Africa and Australia, they tend to get other forms of skin cancer. It's the short, sharp bursts of sun and burning badly, and of course this with package holidays and things is occurring more and more often.
A little bit of the skin here.
So I didn't feel a thing.
So how do you feel?
Good. Good. Didn't feel a thing. No, and it was just so quick. Oh, incredible. And there's nothing there. It's, you know, I expect to have a big bandage around it or something, but no, that's really good. Really pleased.
It was melanoma in their diagnosis, so the mole clinic was right. So I had to go back, have some more taken out by Mr. Rosen. Now I feel fine because I've had a follow-up consultation since where they've not only checked the scar but also checked me for lumps and bumps in other places, which is good and reassuring, knowing that there's nothing else there. So as far as I'm concerned, it's great. With the knowledge that I've got, that I've been looked after so well by the mole clinic, I'm much more reassured and relaxed.
Historically, of those diagnosed with melanoma in the UK, 1 in 5 has not survived. In Australia, however, the death rate is less than half that figure. In Australia, the concept of skin cancer screening and the use of digital imaging was pioneered by Brisbane GP Gordon Patrick, who advised the mole clinic on how the UK could learn from Australia's experience.
Australia's got an enormous skin cancer problem. Skin cancer in Australia is present in epidemic proportions. 80% of all cancer in Australia is skin cancer. Early detection is the only thing that makes any difference to the mortality of melanoma. There is no treatment for late melanomas. So the only window of opportunity that we have in the treatment of melanomas in particular, but also skin cancers in general, is to diagnose them at a very early stage and to treat them aggressively. With the availability of technologies which we have now, this is possible. And it would seem mandatory to me that this should be introduced to reduce the level of mortality and morbidity which the UK presently has in relation to malignant melanoma.
The mole clinic is now detecting melanomas much earlier than is normally the case in this country.
The mole clinic was launched by Ian Mack following his own diagnosis with melanoma in 2002. His objective was to save lives by bringing the Australian screening model to the UK. He achieved this by creating walk-in clinics staffed by trained nurses with access to the latest digital technology. The clinic is now at the forefront of skin cancer screening and recently launched a unique IT infrastructure for skin cancer diagnostics, designed around current UK National Institute for Clinical Excellence guidelines, which links nurses with skin cancer specialists from around the world.
I'm a lawyer by profession and practiced law for nearly 20 years. Everything changed for me 5 years ago though, when I was diagnosed with melanoma skin cancer, and I began to focus very closely on the subject. A diagnosis does focus the mind quite seriously when it involves yourself. And we launched the mole clinic as a method of making this technique available to the general public, who for the very first time could come along to a clinic and have their moles checked using the best diagnostic technique available anywhere in the world today.
So far, mole clinic nurses have screened over 10,000 people. Sue is just one of over 100 found to have melanoma following a visit to the mole clinic. Almost every melanoma detected by the mole clinic has been detected early, is easily treated and entirely survivable. They now plan to work with pharmacies, private hospitals, employers and the NHS to make skin cancer screening more available to more people. Skin cancer rates may be set to soar, but the Mole Clinic believes that nobody should die as a result. Every day, the team are helping people to catch it early and survive.